It's time for another carrier product update. Tune in as we talk directly to the carriers about their new plans, any new network options they have, or which plan designs offer the most savings, and learn about the tools and resources they offer to help you generate more business. Visit our website to learn about all of the carriers we quote in our Carrier Product Update series.
Hello and welcome back to our Carrier Product Update series. This is our Q4 Kickoff Summit. My name is Jason Powers with Legacy Brokers, and today I am joined by a good friend of mine, Caitlin Pellicane, Senior Sales Executive with Cigna Plus Oscar. Welcome back, Caitlin.
Hi, Jason. Thank you for having us back. So sorry I couldn't be in person, but I'm hoping next time we'll be in the studio. Super excited to talk about what happened this year with Cigna Plus Oscar, how we're progressing in the Kansas City market, and what to look forward to for Q1 2024.
Love it. Love it. I'm crossing my fingers we get you here in the studio. So what we do appreciate you taking the time. I know it's a busy time of year for you. It's a busy time of year for our brokers out in the market. There are several brokers out there who probably never heard of Cigna Plus Oscar or may have seen some things out there in the market about Cigna Plus Oscar. What can you tell us about the partnership between Cigna and Oscar Health?
Yeah, I'd love to educate your brokers and get more appointed and writing and asking questions. So Cigna Plus Oscar launched back in 2020. Our first market was Georgia, and it's really the solution to Cigna's portfolio. You know, they're huge in the level funded side, 25 and up, but they really wanted to break into the small group ACA fully insured market. And Oscar was a great partner to help with that tech aspect, and it's our sales force as well. So it's a 50-50 risk sharing partnership, but you get the value of Cigna's robust networks and that great brand name with our technology and platform. So we rolled that out to the Kansas side of Kansas City Q4 of 2021. And then Q1 of 2022, we launched on the Missouri side. So we're on both sides of the Kansas City metro and growing every quarter.
Love it. Love it. And I know you've got some information you want to share about what's going on for 2024. So if you want to cue that up here, we'll
Absolutely.
We'll share the good news of Cigna Plus Oscar with the brokers out in the community.
Yeah, so Cigna Plus Oscar, as a reminder, it's a fully insured product, great for your small groups. So that's 2 to 50 in the Kansas City market. And we're here to provide robust health plans, a great network, and a really easy to use member experience. So if you're not familiar with our team or if you haven't reached out yet, I want to introduce myself. I'm the Senior Sales Executive, Kate Pellicane. I can help you with all of your Missouri-based business. Andy Mueller joined the team last year in the Kansas City metro. So he's responsible for the Kansas side, but honestly, you can come to both of us with questions. And we want to support you through the full sales cycle. So Cigna Plus Oscar is super broker focused. We want to make it easy to quote with us, easy to do business, and easy to manage that business. So Grant Milo is going to be the assigned account consultant. So he's really going to assist with billing questions, training on the member or broker or group admin portal, and he can also help with renewals. And we're pretty hands-on when we reach out with renewal help. So hopefully you feel comfortable, if you haven't written with us yet, knowing that it's a full sales team and we really want to make it easy and valuable to work with us.
Yeah, and as a general agent here in our space, we don't necessarily have a general agent relationship with Cigna Plus Oscar. So a lot of the times we do sort of a co-broker relationship with our agents out in the market. But I'll say that we have tremendous success with Cigna Plus Oscar and being able to really easily administer the groups inside your portal. So it's been the technology play certainly helps with all the things that we do to help support the brokers out in the market. So we appreciate the partnership.
We appreciate your partnership. We're excited that it's growing every quarter, and we love getting that feedback. So I appreciate you, Jason. Yeah. So if you're not sure about where Cigna Plus Oscar is today, like I said, we've kind of been maturing in the Kansas City metro for 1 to 2 years now, but overall we're in 9 total states. And our goal for 2024 is to really scale the business, continue to be a great option for our small group clients and brokers. And then in 2025, we're expecting to ramp up continued growth, whether that's within the states we already exist or growing to new markets overall. So that's just a little bit about where we are today and where we're planning on heading. So today we're just going to quickly go over introducing Cigna Plus Oscar, our main tech value adds, so that Cigna Plus Oscar difference, our top quoted plans. What has Kansas City looked like? What market needs are we meeting? And where do we fill the gaps for your clients in the Kansas City metro? And then, of course, we'll talk about some changes that we made this year just to make the product even easier to administer and what's coming up for 2024. So we kind of briefly talked about the partnership in the intro, but just so you're really clear on the swim lanes with this partnership, we're not just renting the Cigna network, it is Cigna plus Oscar. Of course, when your members are going to the doctor, they're going to reference the Cigna network, which is really, I think, the biggest value add to this product. For the first time in Kansas City, you're getting that robust national Cigna network on a fully insured product. So there's no medical underwriting for your groups that really just can't handle all that administrative work. It's guaranteed issue, and it's going to have, those essential preventative benefits included. Also, it's all written on a Cigna license, which should give you reassurance. Being a newer product, you're still on that Cigna license, which is a renowned national brand. And having those affordable networks, that Cigna license and that Cigna brand name, it does attract employers, right? Most of these small groups in the past, they probably were on a spousal Cigna plan or they had it through a different employer, but maybe they're just too small to get a quote from them right now. So they love being able to be on that option as a true mom and pop small business. And then what Oscar brings to the partnership, because we're kind of the lesser known name, is myself. So it's our sales force. So if you work with Cigna on the level funded or larger group side, keep working with your dedicated rep there. They're fantastic. But you're going to come to myself or Andy for anything that's fully insured ACA related. So we're bringing our easy to use broker portal, which Jason mentioned earlier. Super easy to get a group installed, manage that group, pull ID cards, and even just make changes throughout the year. Are even easier to use member technology so they can get connected with a doctor 24/7, track their steps, or find an in-network provider. So we really say it's simple tools, our people, and our platforms. So if you haven't written us yet, give us a try with your Q4 and Q1 renewals. I really think you're going to like the experience service-wise. So yeah, what does that look like for the Kansas City market? We launched with 2 large group networks. So Local Plus is going to be your base, more narrow network. And I'd say about 5% of our Kansas City membership is on that, but it is growing. And then the rest, 95% are on that broad national open access plus network, which is great because anyone can live in the country and enroll. So if you have remote employees, you don't have to worry about that. We're a great solution. We offer $0 telemedicine through our app. It's available 24/7, and it's a $0 copay on all non-HSA plans. A dedicated concierge team for members, which we have a slide dedicated for this, but it's our version of customer service. Member-centric tools through our app, business concierge for employers to call into. And it's just great to have a new solution on the market. I know Kansas City, it's a small broker pool, so having something newer to talk about if you're trying to grow your book of business or just make those calls this time of year when everyone's up for renewal, it's always good to show something new or quote something new. So the difference is really where I want to talk about our tools. So our mobile app is the center of everything that we do and we invest in. And I think I like to say our first customer was truly the Cigna team. They saw our mobile app, they saw our platforms, and they were like, wow, this is who we want to partner with to enter small employer market. It's going to really meet these members' needs and make it easy for them to understand their plan and access benefits. So I always tell brokers, when you're having an open enrollment meeting, bring along that marketing piece that shows them how to download the app. If your members aren't app people, you can get the same experience through the desktop login. And it's still just the main point is it's user friendly. So they can view their digital ID card at any time through the app, print it out if they want to print it and bring it to the doctor. We have fully Spanish speaking care teams that can assist or English. Members can track steps. So if you sync your steps to a fitness watch or even just the health app in your phone and you meet your step goal, you earn $1 a day, up to $100 per year, and you can check out at any time for an Amazon gift card through the app. So no more snail mail, hoping to get a check back. If you have something, you want to buy somebody a present and you're like, oh, I met 60 days worth of steps, let me check out, get $60 and then still get 40 later on in the year, you can get creative with that. So I think it's a cool feature. It really does get members to just download the app and get engaged in using it. And we do send quite a few emails, texts, and communications throughout the year because our main goal truly is to get members reading those EOBs, understanding the accumulators, actually engaging with the product. And they do, our members do. And then the care guides, that's the most important part of our technology, is having that assigned care team to help you with your needs as you access the plan.
Yeah, I think that's a great opportunity for brokers that do have Cigna Plus Oscar installed on a case
Yes.
to engage with members as well, to just remind them, hey, have you synced up your steps? Because they do have to go into the app. They do have to click on that button to sync the steps. Yep. And once they do that, they get the points. So
that's a really great point, Jason. I always tell my brokers when I help them with renewals, hey, if you don't have anything to really talk about at the renewal meeting, bring that app flyer, get people engaged. Yep. It might help them with like some lingering questions or issues that they may have. And of course, they're happy to do a meeting if they need. So just wanted to highlight our doctor on call feature, which we call virtual urgent care. Again, it's through the app, and why I love it, and I think why it's highly utilized, is it's 4 clicks of a button and you're connected to a provider 24/7. You don't have to download a separate app or put in credit card information. It's very intuitive. And you can use it multiple times a day for $0 a day. Most people don't, but really what it's utilized for is diagnosing a condition, all of the standard stuff that's like, you know, an ear infection, maybe you have sore throat symptoms, COVID, allergies. I know you can get like an inhaler refilled over the phone. You can refill certain prescriptions over the phone, which is nice if you want to skip that office visit. You just don't have time during your workday. And of course, prescribing and triaging urgent care. So super great technology, really easy to use. And it's actually our own Oscar medical group. So our doctors that are using this platform. So when they are working with you, they can pull up your full health history on file and really like work within our formulary to give good information and good prescriptions.
Great.
Yeah. And then really what I think is the true Cigna plus Oscar difference, the magic, what really matters is this dedicated care team. And I always encourage members to download that app or make that desktop portal, and you'll see the pictures of your actual care team. So it's 5 people, 1 registered nurse, and 4 care guides. And the benefit is you can text them throughout the day. Let's say you get an EOB you have a question on, or you think a provider submitted a claim incorrectly, for example. You can just text your care team the documentation you got in the mail, say, hey, I think this is incorrect. This is a provider number. Can you reach out to them and help them, you know, reestablish the claims process? And they can take care of that while you're at work. Like it's almost like having a secretary for some of the pain points, which I know we all could use.
Real quick, Kate,
Yeah.
I can't stress that enough. It's all driven through that member app, like you were saying.
Yes.
And it's like, it's a chat feature. I mean, you call it a text, but it's kind of like a chat feature, and it goes out not just to one person, it goes out to the entire 5-member team, where they all give way in row and take care of whatever situation comes. So
exactly. And I think they're really here to help with like the stressful stuff that you might not know how to handle as a member, right? It's a little inside baseball of insurance that members might not understand. So let's say you switch carriers and now you have to get a prior authorization for a medication or an upcoming procedure. That's a great resource that the care team can help with. Again, you can send that provider number or call them and give them the provider number. They can reach out to that provider and begin the PA process with them, explain how to submit it, where to submit it to, and give status updates. So really encourage our brokers who, if you've been writing us and you haven't really like focused on the care team messaging, I think, again, renewal is a great time to bring that up. So, yeah. So now that we kind of talked a little bit about the partnership and just some of the technology benefits and what we're bringing to the table customer service wise, I just want to do an overview of the Kansas City Metro networks and some of our top selling plans. So again, it is 2 networks that we're providing to the market. Local Plus is not quite as popular, but with growing economic concerns, shrinking budgets, we do see more groups on renewal or just even starting as new clients with us offering a Local Plus base plan. And that's just to save money. It's about 9% cheaper on average from the Open Access Plus plan. But that aside, Open Access Plus is still competitive within the market in the Kansas City Metro. So both are a great option. I always like a dual option. I think choice is great. Sometimes you have employees that don't need every doctor in network, but they'd rather save more money on premium. So it really just depends on employee needs. And then Open Access Plus is one of the broadest networks on the market. You know, you have over 1 million doctors in network. It's available in all 50 states. There's over 17,000 hospitals in the network, and all of our plans are PPO. So even on that narrow network, it's a PPO network. There's no referrals ever required. And there's a national network of labs, radiology, and clinical facilities for behavioral health. So tons of options. I don't think your employees will ever have to worry about choice or access to care. And just to give you a little reminder of where are we present in Kansas and Missouri, because we're not in the total state. And what does that mean? It means a business needs to be sited in one of our counties that we do service in to get a quote. So when you go use your legacy broker's quoting tool, you're only going to be able to quote in counties that are within our service area, but employees can live anywhere in the states or anywhere in the entire country. So in Kansas, we're in Johnson, Leavenworth, Wyandotte, and Miami County. So really rating area 1. And then on the Missouri side of Kansas City, we're in Cass, Clay, Jackson, and Platte. And I do have the St. Louis metro up here as well, but I'm aware that this audience mainly sells in Kansas City. But just in case you sell 3 hours away, we're also in 10 counties in the St. Louis metro.
Yeah, we've got brokers tuning in that will be in that St. Louis metro, so it's good to know.
Fantastic. And just a quick note on St. Louis, that Local Plus narrow network is quite popular because there's a ton of facilities locally to the St. Louis metro that are in network. On the Kansas City side, the main partnerships are HCA, as you can see, Mercy Children's, and then of course you have some options outside of that if necessary.
Yeah.
But I will say our most popular network in Kansas City is the Open Access Plus. And that's because you get everything you saw on the last slide, plus our national network and some more options locally. And of course, you know, in the Kansas City metro, everybody wants St. Luke's, everybody wants University of Kansas, and we even see like Liberty coming up quite a bit. So I think most of your clients are going to be quoting or wanting to enroll on that Open Access Plus plan, but you can always offer both networks. Any questions or concerns about network?
No, I like the idea that we can offer them both, right? And you've got a great product grid with the different plan options that we can offer. And yeah, I like the fact that brokers can pair up a local plus option for maybe there are some clients who don't require St. Luke's to be in network, to give them a lower cost base plan with a buy up for those that do want St. Luke's in that Open Access Plus. So it's a great 1-2 punch and a great strategy to help keep premiums down.
Yeah, I will say, like, even though Local Plus is narrow, it is rare to have a children's hospital in network on a narrow network. So it does give a lot of reassurance to our clients, because that's usually the first question. You know, most people have families that are enrolling and they need to have a dedicated local children's hospital.
Yeah, and on the other side of the state in St. Louis, that having BJC and the Local Plus network is really strong.
Yes,
I think that goes a long way for those groups over in St. Louis.
Yeah, we have BJC, Siteman Cancer. There's even a Mercy facility, so it does really well in St. Louis.
Yeah.
So moving gears, I'm just going to show some of our top quoted plans for 2023. And the reason I'm doing that is we do expect these plans to continue to be poised really well in the market for Kansas City for 2024. They work for us. They're not going away. They're going to be competitively priced, and they are a competitive benefit that fits market needs and fits what's already out there in Kansas City and has been popular for quite a few years. So just 3 ones I quickly want to highlight, because honestly, these are definitely the most quoted that I see and the most sold, and I think they're going to continue that trend, is the Silver 4500 plan. The reason I plug this is our most affordable plan on our portfolio outside of like HSAs. So this is going to be the first true non-HSA plan on our portfolio rate wise. And it's a great blend of a reasonable deductible that meets market needs. It's a great blend of first dollar co-insurance and cost shares and co-pays. And we just see people using this a ton as a great like base plan for employees. Silver 2750, I would say, is definitely a big competitor against the 4500. It's a little bit more in premium, but you get a much smaller deductible and a smaller out-of-pocket maximum. So that's the true benefit when you move from the 4500 to 2750. Copays are about the same, but really the main people love that is just having a Silver with a pretty moderate deductible is great for Kansas and their needs. And then the Gold 2000 is the plan we see most as kind of like the buy-up or the management plan. It's a reasonable plan, fits market needs. It's one of our most competitively priced gold plans, but we do see people also offering the Gold 3250 and the Gold 1200. So you'll see that on another slide. And then I like to call this the perfect pair. So we see a lot of people offering HSA in the Kansas City Metro. You know, some groups love it, some groups hate it. It really just depends who you're meeting with. But I like to encourage my brokers to pair an HSA with one of our silver plans that isn't a high deductible plan. And that being is not everybody in a group is always suitable for an HSA, right? Like if they have a tier 3 medication or even a tier 2, or if they're going to see a lot of doctors, they might get very frustrated with that HSA. And I have seen it cause tension for brokers who, weren't informed by the employer. So keep that HSA, but also offer it in conjunction with our Silver 3500 plan. And the reason I love this plan is it's actually less money in premium than this HSA. It's a little bit less, I'd say like 5% every month. And then you have a lower deductible, and it's a great blend of copays for office visits and for RX for your members who maybe are inappropriate for an HSA. So just something to keep in mind that I think makes our portfolio really strong, and I'm seeing more brokers utilize.
I like
It's always good.
Perfect pair. I like that. That's something I think that, as brokers are going out and talking to groups, and 9 times out of 10, we'd seen where HSA plans versus a traditional copay plan didn't really have the price disparity that really drove the conversation toward HSA qualified plans. So being able to kind of pair those up and showing, look, one way or the other, they're priced pretty much the same. You can certainly buy other plans to get some of that price separation, but actuarially, those two probably have similar values to them. So.
And that's correct. And really, the reason I always urge this is we are seeing less of a cost benefit on HSA, but you do have some people that are just bought into the product for the investment purposes, which is great. But I want to make sure that everybody's happy. And when we have happy clients, brokers are happier. And I think it's my due diligence as the carrier rep to make sure they know about this option.
They like contributing to their health savings account. They want to be able to continue to do that. So you need a plan to do it.
Exactly. So then, we highlighted about 5 plans, but these I would say are our top sellers for 2023, and they're going to continue to grow, I think, for 2024. So it's a great range of like silver and gold and platinum, which I think is aligned with, honestly, the overall membership tiers in the Kansas City Metro on the fully insured side. So really all this means is Cigna plus Oscar, since we've launched, we've met market needs, we've been a competitive player, and we're going to continue to be a competitive option for 2024. We aren't going to shake things up a ton. We'll probably add 1 to 2 higher deductible plans that are going to be a good base plan, and those are going to be released at the end of September. So the pricing information on that and the benefit details, which I'll be sure to get your office informed on those and educated so you can send them out to everybody.
Thank you.
So just some quick broker tools, resources, some changes we made. We've enhanced our member ID card. So for 2022, it kind of looked like this, where it said the Cigna plus Oscar brand name. And we did get some feedback from providers in Kansas City that it was a little bit confusing. So we've included the Cigna network emblem on here, which is great because now providers, if you're handing them the card for the first time, maybe they haven't heard of us being a newer carrier, they know that it's the Cigna network. But of course, on the back of the cards, there's a phone number where they can call in to verify coverage as well, or they can create an account on our portal to verify coverage. So it should be really easy. But if you have any issues, of course, that care team is going to be looped in immediately.
That's a smart enhancement. I think from a member experience perspective, no matter how many times a member shows their card with the Cigna plus Oscar logo across the top, too many providers are gravitating toward that Oscar and not looking at the Cigna. So putting it on a second time, I think is smart. It's great.
Right. It's just more branding can always help. So. And then I just wanted to make sure brokers are aware, if you've written us before, here's some key numbers or contact information for navigating our product. Or if you're new, just so you have reassurance, members can verify eligibility and their providers right away. We have easy to call in numbers for prior authorizations. Claims can be sent electronically or by mail by providers. And one quick thing, we do require a HIPAA authorization on file to have the care team speak with your broker, or you can get verbal authorization with the client if you're calling in. So we just want to make sure brokers feel comfortable with the care team. We're not trying to replace you. We're trying to supplement your job so that sometimes it's quicker to have the member just like get in contact with that care team or have the provider get in contact. We don't want to keep you out of the loop. We want to make it easier. So just something I like to throw on there.
Yeah, I have a story actually about a broker who was in a meeting renewing an account.
Yeah.
Individual approached them in the middle of the meeting, talking about an issue they were having with a bill, didn't understand it. The broker had them pull up the app, contact the member care team during the meeting, finished the meeting, was walking out the door, and that member had response and was just ecstatic about how easy that was versus calling an 800 number, waiting on hold to get transferred to the right department, all those things. Just being able to access the member care team, I think, again, it's a differentiator for sure.
Perfect. I love to hear that. We actually created our technology because our owner got an EOB and he was super confused. And that's where they got the idea of like, yeah, if we could instantly text like a health insurance trained person right away, it would make life a lot easier. You don't always have time to take time from work to hop on a phone call,
Yeah.
And then just a reminder of our resource pages, we have a highosker.com/brokers. That's where you can find all of our updated plan grids. That's going to be updated very soon with all of the 1/1 stuff because it's crazy that summer's over and it's right around the corner, but it's also very exciting. And then broker portal. This is where you're going to manage your book, get appointed to sell, enroll clients, view your commission statements or bonus statements, and where you can update information on the members. So I urge everybody on the call, if you're not appointed with us yet and you find our product interesting or you think we might be a good fit, get appointed as soon as possible. It can take about 2 weeks to get an approval back. And I just don't want to see anybody get delayed commission. So even if you're not totally sure if it's going to sell for Q1, it's always good to be prepared and ready if you get a group that is interested.
Yeah, and our staff here at Legacy can help get all that stuff sorted out for any brokers out there.
Yes, I know you guys went through it yourself and you understand the process, so great resource to help.
Yeah.
And yeah, so you can pretty much do everything from your broker account. It's super easy to manage. You can update your address if you move. I love viewing the commission statement. It's going to show up there monthly, and then you'll see a full grid. And when it comes time for tax time, your 1099 is going to be there as well. This is where you can also view all of your policies, make changes like QLE changes, terminate groups, renewals. That's all going to be on your broker portal. It takes about 20 minutes, honestly, to go through an actual enrollment. We have a census upload system, and we have some unique rules. Like, for example, if at least 7 employees enroll, we don't require any quarterly wage document. So it is really easy to get a group in quickly. And then my favorite thing to brag about is the digital ID card. So within 24 hours of approval, usually it's within an hour, that digital ID card will be in your broker portal for you to print for members, or your members can just download the app and do that. I just wanted to do a quick, plug. So average 24-hour approval time. I think 96% of our groups are approved within 24 hours. So it is great for your stragglers that are late in the month, which always happens during busy season. And usually
they always start early.
And they're never the first ones to complain about ID cards, right? So being able to have it within an hour is great. And then key upcoming dates. So we couldn't really talk about specific new plans because they're not released yet. But Q1 2024 quoting will be live on 10/5. And then those new plans will release on 9/28. And you can actually start enrolling 1/1 new business on 11/1, but 12/1 is live and ready to go on our portal.
Caitlin, I don't know about you, but we have group or brokers that are bringing in groups that are already looking for January 1. So this is timely. Yes. By the time this posts on the site, we will have links to the new product grids for 2024 down below. So
perfect. Yeah, and on that resource website, definitely keep an eye out. We have some planned spotlights that I sent over to Jason, and I really want everyone to take a look at our broker bonus flyer. It's valid through 12/15 effective dates. So if you have any 11/1 groups that apply, 11/15, 12/1, 12/15, take a look at it. Sorry about that. And
uh-oh. You're on
So-
mute. There you go.
each plan comes with a $0 virtual urgent care feature. Just as a reminder, we have a local plus narrow network and a national open access plus network. And we're bringing best in class broker tools, compensation, bonus program, and a really easy to use experience. So if you haven't tried us out yet and you have fully insured clients that could be a good fit, we're happy to help you through that process. Sorry about my dog. You heard another dog barking. And then here's the team. So we like to give out our personal cell phone numbers along with our direct email address. Again, I can help with Missouri. Andy can help with Kansas. We can both kind of triage and help with both. We just want to make sure you know that the Kansas City Metro is well taken care of, and we really want to be hands-on to help you with any questions you have. So yeah, questions.
That's great. Well, again, Caitlin, I appreciate you taking us through that. Again, for brokers who are not familiar with Cigna Plus Oscar, we can certainly be a resource for you. We'll have obviously this video that you're watching now. Down below this video on our site will be links to downloadable marketing content that you can use in your presentation of Cigna Plus Oscar. Down below that is a call to action for you to reach out to our staff. We can help you with proposals. We can help you put together presentations, get all the SBCs and everything else that you need for enrollment, help you with those submissions, and certainly help you service your Cigna Plus Oscar business. So be sure to give Cigna Plus Oscar a look this Q4 and into Q1, and certainly make it part of your portfolio if it's not already. Caitlin, thank you so much for being on our Carrier Product Update Series, our Q4 Kickoff Summit for 2024. We appreciate the partnership. Any parting words of wisdom for brokers as they head out into the craziness of busy season?
I just want to say good luck. We're here to support you on the Cigna Plus Oscar team. And absolutely, if you're not appointed yet, get appointed. We want to make sure there's no delay to commissions, and check out Cigna Plus Oscar. I think with our census upload, our quick turnaround time, and those same day digital ID cards, if you have a fully insured group that's looking for good ACA coverage, we're going to be a really easy carrier to put that business with.
Definitely. And the turnaround time is incredible. So always a great option. Always good to talk to you, Caitlin. Have a great Q4 yourself, and brokers out in the market. Happy selling.
Thank you for watching this edition of our Carrier Product Update Series. Visit our website to watch other episodes.